Hi everybody, and welcome to our module on the newborn nursery. I'll start this video by going through some of the routine things that are done for newborn babies in the nursery, and we'll start by talking about eye care. All newborn babies are administered erythromycin ophthalmic ointment. This is a picture of a baby. You can see this goop in his eye. That's the ointment that has erythromycin in it. And the reason this is done is to prevent gonococcal eye infections. Babies can be exposed to gonorrhea when they pass through the birth canal, and so the ointment prevents them from developing gonococcal conjunctivitis. Importantly, erythromycin is not effective against chlamydial conjunctivitis. Babies can also be exposed to chlamydia at the time of delivery. The only way to prevent this is to diagnose and treat chlamydia in the mother prior to birth. There's no preventative therapy that can be given after. When newborn babies develop conjunctivitis, this is called ophthalmia neonatorum, and there's a limited differential diagnosis, and it depends on when the baby develops conjunctivitis following birth. Conjunctivitis on the day of birth or the first day of life is usually a chemical irritation. It's not an infection. This used to be caused by silver nitrate, which babies were treated with years ago, but this is not used in the US anymore. But babies can develop an irritation from the erythromycin eye ointment or some other cause, and that'll usually happen in the first day or so of life, and this is self-limited and requires no specific treatment. Conjunctivitis that develops in days 2 to 5 is usually gonococcal. We don't see this very often because erythromycin eye drops are always administered for prophylaxis, but if a baby develops gonococcal conjunctivitis, the baby will have purulent exudates and eyelid swelling. You can take a culture of the exudates and you will find gram-negative diplococci, and the treatment for this is usually intramuscular ceftriaxone. Days 5 to 14 is when chlamydial conjunctivitis occurs. Chlamydia causes a watery, mucopurulent discharge, and unfortunately this type of conjunctivitis does still sometimes happen. Even though mothers are screened for chlamydia, sometimes they contract chlamydia between the time when the screening was done and the time of birth. So some babies are exposed to chlamydia. And when chlamydial conjunctivitis develops, the treatment is oral erythromycin for the baby. And then lastly, babies can develop conjunctivitis as part of a herpes simplex virus infection that they acquire from the mother. This leads to a serous, which is a pale yellow color, transparent sort of discharge, and usually this occurs together with other signs of herpes virus infection. So these babies will often have vesicles on the skin and other signs of a herpes infection, not just conjunctivitis. And this can occur in 5 to 14 days after birth, just like chlamydia, but it actually can happen up to 6 weeks after birth. And the treatment is with acyclovir, which treats not just the conjunctivitis, but the entire systemic herpes infection. In the newborn nursery, babies are given a single intramuscular dose of vitamin K, and the reason this is done is to prevent vitamin K deficient bleeding. Babies can become deficient in vitamin K for a couple of reasons. First of all, their GI tract is sterile at birth, and one of the major sources of vitamin K is the bacteria in our colons. In addition, for babies who are breastfed, there's not a lot of vitamin K in breast milk. So for both of these reasons, a single IM dose of vitamin K is administered, and the idea is to reduce the risk of any form of neonatal hemorrhage in the baby. The hepatitis B vaccine is the only vaccine that's given to babies in the first 24 hours of life. In another video, I talk about the vaccination schedule for children, which is shown on the screen here. Most of the vaccines begin to be administered at 2 months of age, as shown here. The only thing given before 2 months is the Hep B vaccine. It's given within the first 24 hours of life and then again at 1 month. The reason this is done is because if mothers have hepatitis B, they can pass the infection on to their baby. And when newborn babies get hepatitis B from their mother, it almost always leads to chronic disease and potentially cirrhosis and liver failure. So for this reason, the hepatitis B vaccine is always given shortly after birth within the first 24 hours of life. Let's talk about management of the umbilical cord. So it's clamped and cut at the time of birth, and then shortly after it will become necrotic, like what you see in this picture here in this baby, and eventually it will fall off and the baby will have a belly button. All you have to tell parents to do is to keep the stump dry. There's no need to clean it or sterilize it. If some bacteria get into the stump, this can actually help the cord separate, so it's not a bad thing. Omphalitis refers to infection of the umbilicus and surrounding tissue. This sometimes happens in newborn babies. It's basically like a cellulitis. The skin will turn red surrounding the umbilical stump. In babies, these are usually polymicrobial infections, and there is a risk of sepsis, so these babies are treated with IV broad-spectrum antibiotics. This is a picture of an umbilical granuloma. This is the most common cause of an umbilical mass. It's very soft and it's moist and it's pink like you can see in the picture. and these occur in a small proportion of babies, and the treatment is with topical silver nitrate. Silver nitrate, if applied over time, will lead to the granuloma eventually falling off. Let's talk about some of the screening that's done for newborn babies in the nursery. Babies should have their oxygen saturation measured by pulse oximetry. This is a screen for hypoxemia. In babies who have any cyanotic congenital heart disease lesion, this screen will show a low oxygen level. Most babies have a blood test done called a blood spot test. This screens for many medical conditions. It screens for things like congenital hypothyroidism, congenital adrenal hyperplasia, phenylketonuria, and many other rare inborn errors of metabolism and other congenital problems that can be identified by a simple blood test. And then lastly, babies have a hearing test to screen for congenital causes of deafness. There are devices that send a tone into the baby's ear and then can measure the action potential in neurons that pick up that sound. Let's talk about feeding of newborn babies. Mothers are encouraged to frequently feed their babies to avoid hypoglycemia. In utero, the baby has a constant supply of glucose from the mother and the placenta. After birth, the baby has to make its own glucose between feedings from the liver, and that process can be immature and take time to develop. So for this reason, frequent feedings are ideal. You should also know that full-term babies lose weight. This is totally normal and not a sign of any pathology. They lose up to 10% of their birth weight, usually within the first few days of life. And this is because, again, you've taken away the placenta, which is a constant source of nutrition, and now the baby has to feed and get its own nutrition, and it takes days for the baby to adapt to this new extrauterine life. Usually these babies will gain back the 10% of weight that they lose by about 10 to 14 days of life. And then after this, babies grow very rapidly. Infants double their birth weight by 4 months of age, and they triple their birth weight by 1 year. There are 2 substances in the blood that can be monitored in newborn babies. Those 2 substances are the glucose and the bilirubin level. Glucose is not routinely monitored in newborn babies who are healthy and well, but you do monitor for hypoglycemia in babies at a high risk of developing a low blood sugar. So these include preterm babies and small babies. These babies can have underdeveloped livers and they're not able to produce enough blood sugar. Large babies can also develop hypoglycemia because they're so big they consume glucose and lower the glucose level. And then infants who are born to diabetic mothers are exposed to high levels of glucose in utero. After they're born, when those high levels are taken away, often their cellular machinery to break down glycogen and produce glucose is underdeveloped, and so they can develop more significant hypoglycemia. I talk about neonatal hyperbilirubinemia in detail in another video, but by way of brief review, babies who develop very high bilirubin levels after birth can develop BIND, which is bilirubin-induced neurologic dysfunction. So in order to prevent the development of BIND, there are a couple of things that are done. First of all, babies are visually assessed for evidence of jaundice. You can measure the bilirubin through a transcutaneous technique that uses the reflection of light from the skin to estimate the bilirubin level. And then lastly, you can do a blood test to measure the total serum bilirubin. And I talk about this in detail in the other video on hyperbilirubinemia in newborns. Newborn males can be circumcised. This is an elective procedure where the foreskin is surgically removed. There are a couple of potential benefits. Risks of penile cancer are low overall, but they're lower in males who have been circumcised. Males who have been circumcised are also less likely to develop a UTI. There are some disorders of the foreskin that males can develop, like inflammation and fibrosis, and these obviously won't happen after a baby is circumcised. And then males who are not circumcised have higher rates of transmission of certain sexually transmitted viral infections like HIV, human papillomavirus, and herpes simplex. The downside of circumcision is the procedure carries some risk. The baby can develop bleeding or infection following circumcision. There can be injury to the glands of the penis, and then it's rare, but some babies following circumcision have developed urocutaneous fistulas where urine leaks out of the penis because of damage to the penis. Moving on, let's talk about breastfeeding, and we'll start by talking about the contents of breast milk. So breast milk contains lactose. Lactose is a disaccharide. It's made up of a molecule of galactose and a molecule of glucose. Breast milk also contains lots of antimicrobial components which are very good for babies in terms of preventing infection. First of all, there are antibodies in breast milk, mostly IgA antibodies, and these serve as a form of passive immunization. The antibodies are passed on to the baby and protect the baby from infection. There are also maternal white cells like macrophages and lymphocytes in breast milk. There's a component called lactoferrin which has antimicrobial activity, and there are also enzymes called lysozymes which break down bacterial cell walls. And then lastly, you should be aware that breast milk has a relatively low content of vitamin D, so in babies who are going to be strictly breastfed, vitamin D supplementation is recommended. The greatest benefit to the child for breastfeeding is that it lowers the risk of infant infections, especially infections involving the GI tract and the lungs. There are also possible long-term benefits to the baby from breastfeeding. There are some studies which have shown reduced rates of allergies, diabetes, and obesity among babies who are breastfed. There's also benefits of breastfeeding to the mother. Women who breastfeed have a lower risk of breast and ovarian cancer and possibly a lower risk of cardiovascular disease. Breastfeeding is also very good for helping the mother and the child to begin to bond. And women who breastfeed tend to recover from childbirth faster. They also lose weight because they are burning calories by producing the milk that the baby consumes. For women who breastfeed, there's a longer period of time before they begin having menstrual periods again. Breastfeeding prolongs the postpartum and ovulation period, and women tend to like not having their menstrual periods for a while after giving birth to a baby. And then lastly, there's a cost savings associated with breastfeeding. It's more expensive to buy formula. Shown on this slide are some of the contraindications to breastfeeding. One of them is a herpetic breast lesion. This is a picture of a woman who has a herpes simplex infection of the breast, and this woman should not breastfeed because her baby can acquire the infection. Women who have HIV or HTLV infections also should not breastfeed because they can pass the virus to the baby. It's uncommon, but some women after birth require treatment for malignancy with either chemotherapy or radiation, and those women shouldn't breastfeed. Any woman who uses illicit drugs or consumes alcohol shouldn't breastfeed because those substances can end up in the breast milk. And then lastly, galactosemia is an inborn error of metabolism, and if the baby has this, the baby can't process lactose, which contains galactose, and therefore that baby should not be breastfed. I'll finish this video with two GI conditions that occur in babies that are triggered by substances in the food they are being fed. The first one is called food protein-induced enterocolitis syndrome. This is a hypersensitivity reaction. Usually it's caused by proteins found in cow's milk or soy milk. So usually this is going to be a baby who is being formula fed. It can occur, but it's rare in exclusively breastfed babies. It starts shortly after birth, and the baby will have vomiting and diarrhea after eating, and the diarrhea and vomiting can lead to dehydration and failure to thrive. This is a clinical diagnosis. There's no blood test for this disorder. The diagnosis is made by identifying vomiting and diarrhea in a baby, usually one that's being fed formula. The treatment is to eliminate the trigger substance, so usually babies are switched from formula to something else that doesn't have proteins from cow milk or soy in them. Once you identify the trigger substance, you feed the baby foods that do not contain that substance, and usually babies outgrow this by about 3 years of age. A related syndrome is called food protein-induced proctocolitis. This is also a hypersensitivity reaction to protein found in baby's food. It also starts shortly after birth. What's different about this condition is half of the affected babies are exclusively breastfed, so this can occur in a baby who is not formula fed and only consuming breast milk. The most common trigger, once again, is cow's milk, although in this case, the cow's milk can be consumed by the mother, and that can cause the baby to develop this condition, or the baby can be formula fed and get cow's milk in that way. For your board exams, what you want to remember about this condition is that the baby will look perfectly well, and I've shown you a picture of a happy baby to remind you of this. The main clinical feature is that the baby will have blood-streaked loose stools. So this will be a parent who brings in their child, tells you there's blood in the stool, but the baby looks well. Sometimes the baby will have other evidence of allergic disease as well, like eczema of the skin. This is also a clinical diagnosis, and the treatment is to eliminate the trigger substance so that the baby stops having the blood-streaked loose stools. And that concludes our module on the newborn nursery.